Arthritis, one of the most common concerns among seniors. But did you know that there are simple, daily habits that can prevent joint pain, swelling, and stiffness before they start? Welcome to Health 999. Today, we'll uncover 5 powerful habits that can help prevent arthritis and protect your joints as you age. Let's get started. 1. Keep moving. Stay active every day. Staying physically active is one of the most effective ways to prevent arthritis, especially in older adults. Movement is not just good for the heart and muscles, it plays a critical role in joint health. Our joints are surrounded by cartilage and synovial fluid, which act as natural lubricants and shock absorbers. When we move, blood flow to the joints increases, delivering oxygen and nutrients that help repair and maintain healthy cartilage. Without regular movement, joints become stiff, cartilage can break down more quickly, and inflammation may build up, leading to arthritis over time. Many seniors fear exercise, worrying it might cause pain or injury. But the truth is, the right kind of physical activity can actually reduce pain, improve range of motion, and enhance overall mobility. The key is consistency and choosing exercises that are gentle on the joints. Low-impact activities such as walking, tai chi, yoga, and swimming are perfect examples. These exercises build strength and flexibility without putting too much stress on the joints. Let's take walking, for instance. A daily 30-minute walk can increase joint lubrication, improve circulation, and keep leg muscles strong, all of which support your knees and hips. Swimming, on the other hand, provides resistance training in a weightless environment, allowing you to build muscle and improve joint mobility without the impact. Water aerobics is another great option, combining movement and support for joints in a fun and social setting. Stretching is also crucial. Regular stretching routines help maintain flexibility, reduce stiffness, and prevent muscle imbalances that could lead to joint misalignment or strain. Gentle morning stretches or chair yoga can be especially helpful for seniors, as joints are often stiff after a night's rest. Experts recommend aiming for at least 150 minutes of moderate intensity activity per week, which can be broken down into manageable 20 to 30-minute sessions, 5 days a week. The important thing is to stay consistent. Even short, 10-minute activity bursts throughout the day can make a big difference. If you're new to exercise or living with early signs of joint discomfort, it's wise to consult a healthcare provider or physical therapist. They can help design a safe, personalized plan that fits your abilities and goals. Remember, movement doesn't have to be strenuous, it just needs to be regular. The old saying goes, move it or lose it. This is especially true for your joints. By making daily movement a priority, you can maintain your independence, reduce the risk of arthritis, and enjoy a more active and pain-free life as you age. 2. Eat anti-inflammatory foods. One of the most effective ways to prevent arthritis, especially as we get older, is by focusing on what we eat. The food you put on your plate every day has a direct impact on your body's inflammation levels, and chronic inflammation is one of the root causes of joint pain, swelling, and long-term cartilage damage. Let's break it down. When we talk about anti-inflammatory foods, we're referring to natural, whole foods that contain vitamins, minerals, and compounds that help reduce inflammation in the body. These foods can protect your joints, slow down wear and tear, and in some cases, even reduce pain if you're already experiencing mild arthritis symptoms. So, what should we be eating? First on the list, fatty fish, like salmon, sardines, tuna, and mackerel. These are rich in omega-3 fatty acids, which are proven to fight inflammation. Try to eat fish at least twice a week. If you're not a fan of seafood, you can talk to your doctor about taking an omega-3 supplement. Next up, colorful fruits and vegetables, especially berries like blueberries, strawberries, and cherries. These are packed with antioxidants, powerful substances that protect your cells from damage and help your body fight inflammation. Leafy greens like spinach, kale, and broccoli are also excellent choices. They contain vitamins C, E, and K, which support joint health and bone strength. Olive oil is another great addition. It contains a compound called oleocanthal, which works similarly to anti-inflammatory medications like ibuprofen, but without the side effects. Replace butter or vegetable oils with extra virgin olive oil in your cooking whenever possible. And don't forget about nuts and seeds. Almonds, walnuts, chia seeds, and flax seeds are all rich in healthy fats and fiber. They're great as snacks, in smoothies, or sprinkled over your meals. On the other hand, we also need to talk about what to avoid. Highly processed foods like packaged snacks, fast food, fried items, and sugary drinks can actually increase inflammation in the body. These foods are often loaded with trans fats, refined sugar, and preservatives, all of which can make arthritis symptoms worse over time. Instead of soda, try green tea or turmeric tea. Both have anti-inflammatory properties and are easy to incorporate into your daily routine. Turmeric, in particular, contains curcumin, a natural compound known to reduce joint pain and stiffness. Now, here's a simple tip to remember. If it comes from the earth and hasn't been heavily processed, it's probably good for your joints. Eating anti-inflammatory foods doesn't mean following a strict diet. It's about making small, smart choices every day, like adding a handful of berries to your breakfast, swapping out white bread for whole grains, or cooking your vegetables in olive oil instead of butter. These simple shifts can have a powerful long-term impact. They can help you maintain healthy joints, reduce the risk of arthritis, and enjoy greater mobility as you age, naturally, and without relying solely on medication. So next time you're at the grocery store, think about your joints. What you put in your cart today could help protect your health for years to come. 3. Maintain a healthy weight. Maintaining a healthy weight is one of the most effective ways to prevent arthritis, especially in older adults. As we age, our joints naturally begin to wear down. But when we carry extra body weight, the pressure on our joints, especially the knees, hips, and lower back, increases significantly. This added stress speeds up the wear and tear, leading to a higher risk of developing osteoarthritis, the most common form of arthritis among seniors. Let's break it down. For every extra pound of weight, your knees experience about 4 pounds of added pressure when walking. That means if you're just 10 pounds overweight, your knees are feeling the force of an additional 40 pounds with every step. Over time, this can cause the cartilage in your joints, which acts like a cushion, to break down more quickly, leading to pain, stiffness, and inflammation. Excess fat tissue doesn't just cause mechanical stress, it also contributes to chronic inflammation throughout the body. Fat cells release chemicals known as cytokines, which can trigger inflammation in joints. This inflammation may not be visible at first, but inside your body, it can quietly damage the joint lining and worsen arthritis symptoms. So, losing weight not only reduces physical stress on the joints, it also lowers the chemical inflammation that leads to joint damage. But here's the good news. Even modest weight loss can make a big difference. Studies have shown that losing just 5% to 10% of your body weight can reduce joint pain and improve mobility. If you weigh 180 pounds, that's only 9 to 18 pounds. It's achievable, and the results can be life-changing. So, how can you do it? You don't need extreme diets or exhausting workouts. The key is slow and steady progress. Start with simple changes. Reduce portion sizes, eat more whole foods like vegetables and fruits, and cut back on sugary drinks and fried snacks. Drinking more water, walking daily, and being mindful of emotional eating are also helpful. Exercise is crucial too, not just for burning calories, but for strengthening the muscles that support your joints. Strong muscles help take the pressure off your knees and hips, reducing pain and risk of injury. Try low-impact activities like walking, swimming, or Tai Chi. These are gentle on your joints but excellent for your overall health. If you're not sure where to begin, consider talking to a doctor or a registered dietitian. They can help you create a personalized plan that fits your health condition, age, and mobility level. Remember, weight loss doesn't happen overnight, but every small step adds up. And the benefits go far beyond joint health. You'll feel more energetic, sleep better, and reduce your risk of other diseases like diabetes and heart problems. Maintaining a healthy weight isn't about perfection. It's about protecting your joints, preserving your independence, and enjoying a pain-free, active life as you grow older. 4. Protect your joints during daily activities. Our joints are constantly working, from the moment we wake up to the moment we go to bed. Whether we're brushing our teeth, standing up from a chair, opening a jar, or walking across the room, our joints are involved in almost every movement. That's why it's so important to protect them, especially as we age. For older adults, joint wear and tear is natural, but we can slow it down significantly with smart, daily habits. Let's explore how. First, be mindful of your body posture, especially during routine movements. When bending down to pick something up, avoid putting pressure on your lower back or knees. Instead, Bend at the hips and knees while keeping your back straight. Use your legs to lift, not your spine. This simple adjustment can prevent strain on your knees and lower back. Next, make your environment joint-friendly. For example, use chairs with sturdy armrests. They can help you stand up or sit down without putting too much stress on your knees. Install grab bars in bathrooms, especially near the toilet or in the shower, to make movement safer and easier. Place items you use often within easy reach so you don't have to stretch or twist your body unnecessarily. Another smart habit is to take breaks and change positions often. Sitting or standing in one position for too long can lead to stiffness, especially in the hips and knees. Try to stand up and stretch every 30 to 60 minutes if you've been sitting. Gentle shoulder rolls, neck turns, and ankle circles are easy to do and take only a minute, but they keep your joints from getting stiff. Don't forget about your hands and wrists, which are often overlooked. Avoid gripping things too tightly. If you struggle to open jars or bottles, use assistive tools or jar openers with soft grips. These reduce stress on your fingers and wrists. Using larger pens or utensils with padded handles can also make writing or eating more comfortable. Footwear also plays a role. Wearing supportive cushioned shoes can protect the joints in your feet, knees, and hips. Avoid high heels or shoes with poor arch support, as they can throw off your alignment and increase joint strain over time. Lastly, listen to your body. If a certain movement causes discomfort or pain in your joints, that's your body telling you something. Don't push through the pain. Modify the activity or seek advice from a physical therapist or healthcare provider. Protecting your joints during daily activities doesn't mean you need to limit your lifestyle. It simply means being aware, making small adjustments, and building smart habits that preserve your mobility and comfort for years to come. Because every step, every reach, every movement matters, especially as we age. 5. Regular checkups and early detection. One of the most important, yet often overlooked, habits in preventing arthritis is seeing your doctor regularly and paying attention to early warning signs. As we age, joint pain, stiffness, or reduced mobility may seem like a normal part of getting older. But it's not something you should ignore. These symptoms can be early signs of arthritis, and catching them early makes a big difference. When arthritis is diagnosed at an early stage, there are many options to manage it without surgery or strong medications. You can use physical therapy, supplements, targeted exercises, and anti-inflammatory diets to slow down the progression of the disease. But once the damage is done, once the cartilage in the joints is worn down, it's much harder to reverse. That's why routine checkups with your primary care doctor, or even better, a rheumatologist, are so important. A rheumatologist specializes in joint and autoimmune diseases and can detect even mild signs of inflammation in the joints before it becomes severe. Through simple tests like blood work, X-rays, or ultrasound scans, doctors can detect changes in your joints early on, even before you feel serious pain. Another benefit of regular medical checkups is monitoring vitamin D and calcium levels, which are essential for bone and joint health. Low levels of these nutrients can make your joints weaker and more vulnerable to damage. Your doctor might recommend supplements or dietary changes to strengthen your bones and reduce your risk of both arthritis and osteoporosis. It's also crucial to be honest with your doctor about how you're feeling. Don't wait until the pain becomes unbearable. Let them know if you're feeling joint stiffness in the morning, if you're having trouble opening jars, walking upstairs, or bending your knees. Even if the pain feels minor, small signs matter. Arthritis doesn't always begin with sharp pain. It can start subtly and worsen over time. In addition to physical exams, early detection involves keeping track of your daily lifestyle and risk factors. Are you overweight? Do you have a family history of arthritis? Have you had a previous joint injury? All of these increase your risk. Regular checkups help your doctor tailor a plan specifically for you to keep your joints strong and healthy for as long as possible. Remember, preventing arthritis isn't just about treatment, it's about awareness. The earlier you detect changes in your joints, the more options you'll have to preserve your mobility and independence. So, make it a habit. Book those checkups, not just once a year, but as often as your doctor recommends. Your future self will thank you for taking care of your joints today. Preventing arthritis isn't difficult. It starts with small steps, practiced every day. If you found this video helpful, please like and subscribe to Health 999. And don't forget to share it with your loved ones, because strong, healthy joints lead to a better quality of life. Thanks for watching.